Hello everyone, this is Dr. Humanist here. Let us study the association between the microbiota and the various autoimmune disorders. Okay, microbiota is nothing but the combination of microorganisms like bacteria, viruses, fungi, which are normally present in our gut, especially. Okay, so how they are causing autoimmune disorders? So there are four main mechanisms. So most important is molecular mimicry. Okay, what happens is the antigens from these organisms will be confused as self antigens, and the body will produce more auto antibodies against the self antigens. And next is leaky gut syndrome, and that is because of dysbiosis. Okay, this what it will cause is this: there is increased intestinal permeability, and all the bacterial antigens and toxins related to the bacteria will enter the bloodstream, causing the systemic inflammation and autoimmunity. Third one is inflammatory cytokines. As we know, there is inflammation when there is a dysbiosis. There is a changes in the gut microbiota. There is inflammation occurs, and because of that, cytokines are released, which will trigger more and more systemic inflammation. Okay, and autoimmune pathology. Next is metabolite production. Okay, certain gut microbiota produces metabolites like short chain fatty acids. As we know, short chain fatty acids, they'll cause more inflammation and more risk for autoimmune disorders. So now specifically we'll see every autoimmune diseases and the microorganism associated with it. Okay, first one is rheumatoid arthritis, Prevotella copri. Okay, if we see how it is causing, it is increasing the inflammation, and thus by auto antibody production happens. Okay, porphyria monogingivalis. Okay, because of this there is a molecular mimicry happening. Next is SLE. In SLE, Ruminococcus nialis, because of dysbiosis, there is more inflammation and auto antibody production. Also, lactobacillus, which is normally present in our gut, reduced levels of it can uh, alter the regulatory T cell function and causing the autoimmunity. Multiple sclerosis, Akkermansia muscipula, it induces the blood-brain barrier integrity. Okay, influences and neuroinflammation happens in multiple sclerosis. As we know, there is a demyelinating syndrome. Prevotella histicola, it is linked with modulating immune responses, experimental models. Okay, type 1 diabetes, bacterial species, it promotes inflammation. Okay, then there is a ratio for mictus and bacteroids ratio, which imbalances, causing the autoimmune destruction of the pancreatic this thing cells. Inflammatory bowel disease, E. coli, especially the adherent invasive strains, it disrupts the gut mucosal barrier and promotes the inflammation. Next is Faecalibacter Prausnitzi. Okay, even that causes anti-inflammatory effects, and decreased level of that will are prone for immune inflammatory bowel disease. Ankylosing spondylosis, Klebsiella pneumonia. Okay, molecular mimicry, especially in patients who have HLA-B27 positive. Psoriasis, Streptococcus pyogenes, even that causes molecular mimicry effect. Okay, next is Graves' disease, that is because of Yersinia enterocoltica. It is molecular mimicry, especially antigens, they have TSH receptor mimicking, so that's why there is the auto antibodies against the TSH receptors. GBS, which is very famous, we already know about it, Campylobacter jejuni, it also causes molecular mimicry. Thank you.